all about cystic fibrosis. Cystic fibrosis, CF, is a hereditary disease that affects the body's secretory glands, including those that produce mucus and sweat. The mutation of the CFTR gene causes this disease, leading to thick, sticky mucus in various organs. This can cause a range of issues, mainly impacting the respiratory and digestive systems. Symptoms and complications. The most common symptoms of CF include frequent lung infections, pneumonia, bronchitis, wheezing or shortness of breath, a persistent cough that produces thick mucus, sputum, very salty tasting skin, poor growth or weight gain despite a good appetite, and frequent greasy, bulky stools or difficulty with bowel movements. Complications of CF may involve damage to the lungs due to repeated infections, nutritional deficiencies due to a lack of pancreatic enzymes, CF-related diabetes, bone disease, and even infertility, particularly in men. Diagnosis. CF is diagnosed through various tests. Newborn screening is common in many countries, using a blood sample to check the levels of a certain protein. A sweat test may be used, where a high salt level in the person's sweat indicates CF. Genetic tests can also detect the CFTR gene mutation. Treatment. Treatment for CF is lifelong and involves managing and preventing complications. It's important to note that while there is no cure for CF, treatments have improved significantly over the years. Airway clearance techniques, ACTs. These help clear mucus from the lungs, with techniques such as chest physiotherapy, CPT, where the chest and back are clapped with cupped hands to help loosen mucus. Medications. These include antibiotics to treat and prevent lung infections, medicines to thin mucus, mucolytics, and anti-inflammatory medications. Pulmonary rehabilitation. This includes exercise, nutritional advice, counseling, and education about the disease. Nutritional therapy. As CF affects the pancreas, it can lead to problems with digestion and absorption of nutrients. People with CF often need a high-calorie diet and may need to take digestive enzyme supplements. Lung transplant. In severe cases, a lung transplant may be an option. CFTR modulators, a new class of medication that targets the defective CFTR protein. They can help improve lung function and weight gain. Nursing considerations for NCLEX. Infection prevention. Patients with CF are at increased risk for lung infections. Hand hygiene, isolation during hospital stays, and regular vaccinations are important. Nutritional support. Patients may need assistance with maintaining a high-calorie, high-protein diet and using pancreatic enzymes. Medication management. Nurses should understand how to administer and monitor the effectiveness of medications such as antibiotics, mucolytics, and CFTR modulators. Education. Nurses play a key role in educating patients and families about the disease, including self-care techniques like ACTs. Psychosocial support. Living with a chronic illness can be challenging, so nurses should be prepared to provide emotional support and referrals to mental health resources. Remember, while CF is a serious disease, advancements in treatment and care mean that many people with CF can lead a fulfilling life. As a healthcare professional, your role can significantly impact their quality of life.